I would say evidence-based practice for nursing. I think of nursing as being the art of nursing and the science of nursing, and evidence-based practice really reflects more of the science piece of nursing. And as a profession, we should look at where we have opportunities to see best practices, what has worked best in interventions to, result in better outcomes for our patients. And that requires a little bit of research and inquiry into how other places are doing their work. I think the most important thing in implementing evidence-based practice is to make sure that you have your staff, frontline staff, involved in that change so that it's a cultural change. They're actually looking at opportunities for reducing maybe catheter-associated infections, finding out what other hospitals are doing and learning from those other hospitals and bringing it back to leadership. One of the key opportunities I see with bringing the evidence-based practice back to our hospitals is ensuring that it's interdisciplinary, so that we're all in this together, not only the nurse, the physician, the case manager, the social workers, all of the disciplines, pharmacists are involved in the changes that you need to make in the evidence-based practice you want to present. Some of the tools that we use at Barnstable St. Peter's Hospital and Progress West, as well as throughout the BJC system, one of them is the Elsevier tool. We have Elsevier skills, so when our nurses go in and they want to look at a policy and procedure via the intranet, they will see that policy and procedure and they will see a lot of the Elsevier research that backs up that policy and procedure. The other important use of evidence-based medicine is to help us standardize the information that we're giving to patients. So what we find is a lot of inconsistencies in the information that's passed on, which is confusing for patients and families. So by use of evidence-based practice and research, we can find out what the consistent message we want to give to that particular patient. And I don't mean in a way that every patient needs exactly the same thing. So you take that information and then you tailor it and customize it to that particular patient, but the information itself should be consistent. I think what I would like to see with evidence-based practice is that the staff have all kinds of tools, easy, accessible tools. So evidence-based practice is important to clinical practice because that is how you improve your outcomes for your patients. And so what I have seen throughout BJC, and you can see it throughout the country, when you look at opportunities to improve catheter-associated infections, central line infections, surgical infections, those are some ways that we can look at outcomes and then look at who has the best outcomes and then find out what they're doing that you can learn from and use to improve your outcomes.
So evidence-based practice and our outcome boards can be related to each other because we are looking at numbers ultimately. We're looking to see how well we're performing based on our rounding that we do daily. And we're tracking those trends and we're looking back and we're determining what are we learning from the trends that we're seeing so that we can improve our outcomes ultimately in patient care. Overall, this has benefited patients greatly by allowing our frontline team members to see that objectively the numbers are reflecting a decrease in those trends that we were seeing prior to our outcome boards being put into place.